Joining us now is Mr. Rohit Kumar Singh, Additional Chief Secretary, Government of Rajasthan, Rural Development and Panchayati Raj. Sir, here. So, sir, you have worked closely in the fight against COVID-19. Recently, you have written about how the state plans to make sure that no one is left behind for the vaccine once it's out. Please tell us more about it.
I think when the infection came to Rajasthan in the month of March, we had two parallel problems. One was how to prevent the spread of infection, and one was how to treat people. So we worked equally on both fronts, and we, for example, in Bhilwara, suddenly two doctors of the biggest hospital got infected. And we had this challenge because we knew these doctors were in the OPD seeing patients, and the patients were coming from different villages. So we suddenly realized the magnitude of the problem. And what got compounded was one foreign channel said the Bhilwara is going to be the next Italy. That hurt here. And we realized and we decided that we are not going to let it happen. And we will make sure that Bhilwara becomes a model. So what we followed was the principle of ruthless containment. We said everybody is going to stay home. But we realized with our experience in the civil services of 30 years that if you're going to inconvenience people, you have to ensure that their daily needs, the essential food items, the milk, the medicine, etc., has to be taken care of. And people have to be on their side, on your side. If people become your adversary in the times of crisis, then you cannot, then the problem goes out of hand. So we followed that principle. We said, you stay at home and we will provide you all that you need, but please don't come out of your homes. And the second thing we did was we proactively went to each house and we developed quickly an app, and we decided to survey everyone with what is called ILI, influenza-like illness symptoms. And we quickly had a database of who is likely, who is vulnerable because their age was there, their medical history was there. We also used technology, shared data from Ayushman Bharat. So we worked on all fronts. And as it always happens in Rajasthan, Sanket ji has worked in Rajasthan, he would know that Rajasthan has this tradition of tying tradition with technology in governance. So you asked about the vaccine rollout. We are already onto the preparatory mode. We realized that within 3-4 months, the vaccine will be available. But that is not the end of the problem. That is the beginning of problem number 2. How do you roll out the vaccine in a safe, coordinated, and equitable manner? Because we are country's largest state when it comes to geographical area. How do you ensure that you maintain the cold chain? How do you make sure that it reaches the last mile? How do you create a record of who's vaccinated, who's not vaccinated? And I would refer to the 2 articles written by Mr. Nandan Nilekani in Hindustan Times a couple of months back, where he said, maybe a month back, where he said that like we rolled out Aadhaar, we have to have an authentication mechanism in the vaccine rollout also. So now I used to be health secretary, now I am the secretary of rural development, Panchayati Raj. So we have decided to engage, I have 1,80,000 self-help groups of women that comprise about 20 lakh members. So we are now sensitizing them and training them that you get involved in not only maintaining the last mile of the cold chain, but you also be involved in rolling out the vaccine. Of course, you are not healthcare workers, so somebody else will put the injection in, but you have to be there to sensitize people for what is called IEC, information, education, communication. You get the people for vaccination. So unless we plan, even if the vaccine becomes available, it will be very difficult to have a robust rollout mechanism. So that is what we are planning all about.
All right, Mr. Rohit Kumar Singh, thank you so much and keep up with the good work.